So in public health, we have been watching the trends of COVID-19 in our community to help us understand how social distancing and other important public health interventions are affecting the spread of disease in Maricopa County. And we know that from science, when individuals start to interact more, chances of getting infected increase. So we expected to see more COVID-19 infections several weeks after social distancing was relaxed. In public health, we have to balance allowing people to work and put food on the table while minimizing the spread of COVID-19 in our community. However, we are starting to see some indicators that the number of COVID-19 cases is increasing in Maricopa County, and we have enough information to know that these increases are not due to just an increase in testing that is occurring. Over the past 4 days, we have received reports of the highest number of cases we have ever seen, averaging nearly 500 cases per day. This is in comparison to the nearly 200 cases per day we were seeing previously. Although we typically see more cases a few days after the Saturday testing blitzes, these numbers have been much higher than other Saturday testing blitzes. Additionally, hospitalizations for COVID-19 have increased the past week, and this would not be affected by the availability of testing. We're also seeing higher numbers of hospital beds that are occupied by COVID-19 patients, with fewer ICU beds available than previously. We know this from real-time data that is reported to us from local hospitals. It is important to note, though, that Maricopa County hospitalization rates epi curve is still showing a slight downward trend. This is because this only represents Maricopa County, but that it also has a typical couple of weeks, 2 weeks lag time behind our case count numbers. And then lastly, the percent of positive cases has also begun to increase. So even though an increase in testing could be part of the reason the case counts are climbing, all of these indicators together tell us there's an increased spread in the community. So here's what we need people to know. First, we have COVID-19 circulating throughout our community. Everyone needs to keep at least 6 feet of social distance between yourselves and others whenever possible. And when that's not possible, please wear a cloth face mask when you leave your home. If you can avoid going out, you should do so. The less time you spend around others, the lower your potential of exposure is. People who are at higher risk of COVID-19, like those over the age of 65 and with chronic medical conditions, should absolutely avoid going around others outside of their household whenever possible. But remember, even if you are not a person in that high-risk category, you are just as likely to become infected with COVID-19. You are just less likely to experience severe illness.